Hello, Terry Lynch here, medical doctor, accredited psychotherapist, best-selling mental health author, creator of mental health courses for mental health professionals, psychotherapists, counsellors, psychologists, social workers, etc., and for the general public. This brief video is primarily for mental health professionals, but is likely to be of interest to anyone who's interested in mental health. We hear a lot about mental health in the media. We hear a lot about the psychiatric diagnoses. We hear many assertions from sources considered trustworthy and reliable that the psychiatric diagnoses are brain disorders, chemical imbalances, genetic conditions, and so on. Do you ever stop to ask yourself how trustworthy, how reliable these assertions are? As a young doctor running a GP practice 25 years ago, I enthusiastically believed everything that I had been taught in relation to mental health. Gradually and increasingly, I began to question. I began to critique. I began to apply what we might call rigour to what I had been told in relation to mental health in my medical training. And it's critiquing and rigour that I want to talk about briefly today to mental health practitioners, to psychologists, psychotherapists, counsellors, and any medical doctors who might be interested here too. Dorothy Rowe was a very well-known British-based psychologist and author of many books, including this one, Depression, The Way Out of Your Prison. I was fortunate to have had contact with Dorothy Rowe over the years, primarily through the excellent British publishers, PCCS Books, who published the British edition of my book, Beyond Prozac. Dorothy Rowe very kindly wrote the foreword to that book. She also kindly mentioned me on several occasions in the third edition of her classic book, Depression, The Way Out of Your Prison. Dorothy Rowe had a great mind, a critical mind. In an article from New Scientist, she wrote, under the title, Comment and Analysis, Ask Better Questions. She wrote, psychologists fought hard to be seen as empirical scientists, yet many of them are still confusing belief and rigour. What she's saying here about psychologists, I believe, applies pretty much across the board to counsellors, psychotherapists, and indeed to many doctors. Confusing belief with rigour. Dorothy Rowe is here recommending that psychologists, and I would add, and I'm sure she would too, psychotherapists, counsellors, other mental health professionals, assume nothing in terms of what you have heard in relation to, for example, the psychiatric diagnoses. Be willing to test, be willing to critique everything. I began to test and critique my medical training in mental health 25 years ago, a journey that has taken me to the place I now occupy, within which it is very clear to me, for example, that there are no brain chemical imbalances, that there is no verified evidence that any of the psychiatric diagnoses are brain disorders, and that there's very little, if any at all, evidence of verified genetic contribution to the psychiatric diagnoses. All of which means that the potential role, and from my perspective, having worked in this area for over 20 years, the actual role of psychotherapy, counselling, psychology in relation to the psychiatric diagnoses has been greatly underestimated. I'm speaking to therapists now, psychologists, psychotherapists, counsellors. Your training, your work as therapists, is impacted upon by, is generally speaking deferential to, the widely considered superior medical knowledge. There is a hierarchy of mental health professionals. At the top of this hierarchy are the medical professionals, particularly psychiatrists. All other mental health professionals are considered to be at a somewhat lower level within the current paradigm of the psychiatric diagnoses. The question is the position of the medical profession at the top of this hierarchy of mental health professionals, is this position merited? It is assumed to be true, yes, regularly asserted to be true, but are such assumptions, such conclusions, are they faith-based? Is the psychiatric knowledge base faith-based, or, when tested, when rigour is applied, is the psychiatric knowledge base actually evidence-based? What is rigour? The Oxford Dictionaries define rigour as the quality of being extremely thorough and careful. Cambridge Dictionary, the quality of being detailed, careful, and complete. The Merriam-Webster Dictionary, rigour meaning strict precision, exactness. These are very good qualities to bring to your evaluation of what you hear in relation to the psychiatric diagnoses. The title of this article by Dorothy Rowe is interesting. Ask better questions. I was fortunate enough to share a speaking platform with Dorothy Rowe twice, once in Ireland and once in Wales. On both of these occasions, Dorothy Rowe told the audience that a primary purpose of research is to enable us to ask better questions. This is indeed a worthy purpose of research. I began to apply the type of rigour that Dorothy Rowe was talking about as a young doctor over 25 years ago. I began to apply it to what I had been taught as a young doctor in medical school, particularly in relation to mental health. And the more I applied this critiquing and rigour to my medical training in relation to the psychiatric diagnoses, for example, the more I realised that there were glaring examples of misinformation, half-truths, falsehoods, assumptions, poor science, many logical fallacies within the current paradigm of the psychiatric diagnoses. If you would like to increase your understanding of the psychiatric diagnoses, both from a critiquing perspective, but also the provision of a richer trauma-informed, psychologically informed understanding and approach to the psychiatric diagnoses, reply or comment below, and I will ensure that you become aware of when the course that I'm currently working on, working with clients with a psychiatric diagnosis, becomes available. I'm creating this course to coincide with an article I have written to be published in the July 2025 edition of the British Association of Counselling and Psychotherapy's Journal, Healthcare, Counselling and Psychotherapy Journal. Thanks for watching. Have a great day.